Hello everyone, my name is Elizabeth Johnson. I'm one of the new members of the cardiac imaging team down in Jacksonville, and I'm excited to talk to you guys about 4D flow and cardiac MR today. I will say that we've only recently implemented the 4D flow sequence on some of our MR scanners down here, and we are currently still in the testing phase. So I wanted to give a special thank you to Dr. Chris Francois in Rochester for helping me out by providing me a lot of beautiful images and case examples of 4D flow from his practice. I've also worked with Dr. Francois at the University of Wisconsin. He was my cardiac imaging fellowship director, and he taught me pretty much everything I know about 4D flow. So thanks, Dr. Francois, and we'll get started. I have no disclosures. So our learning objectives for the talk today, I will review some basic concepts of phase contrast MR, go over some key differences between conventional 2D phase contrast imaging and 4D flow, and then give some examples of current applications of 4D flow for cardiac MR. I'll start by reviewing some basic physics concepts. Phase contrast MR is based on the use of bipolar gradients that create phase shifts in moving protons. And this diagram here is demonstrating that protons in stationary tissue subjected to a constant magnetic field experience no phase shift. However, when a magnetic field gradient is applied, those spins experience phase shift, and the degree of their phase shift is relative to their location in that magnetic field gradient. With phase contrast MR, we're using a bipolar gradient, and these bipolar gradients have different effects on stationary and moving protons. A bipolar gradient applied to stationary tissue has a net effect of zero phase shift. However, when that same gradient is applied to moving tissue, these spins experience phase shifts that are proportional to their velocity. By measuring the changes in these phase of these moving protons, we can calculate their velocity. The equation at the bottom of the slide is the equation for deriving phase shift, where the phase shift is equal to the gyromagnetic ratio multiplied by the proton velocity multiplied by the change in magnetic moment. The magnetic moment is proportional to the magnetic field gradient strength. Therefore, phase shift is proportional to proton velocity and gradient field strength. With a basic 2D flow phase contrast, the bipolar gradient is applied along a pre-selected axis to provide flow sensitivity in that specific direction. The velocity measured by the phase shift is displayed in two separate sets of images. The velocity grayscale map, which depicts the direction of flow, and here on the left, the flows going from inferior to superior in the ascending aorta are depicted in white, while the flows from superior to inferior in the descending aorta are depicted in black. The velocities combined in all directions make up the magnitude display image. So what is 4D flow MRI? It's a technique that can measure 3D blood flow over both space and time. So phase contrast cardiac MR of the whole heart with flow encoding in 3 spatial dimensions gives us the 3D component. When we acquire these images over multiple cardiac cycle, we're adding the fourth dimension of time. This is an example of the images acquired in a 4D flow sequence. We have the magnitude images in the top left displaying the anatomy, and we have 3 sets of velocity images in the Z, Y, and X directions. So now we're going to move on to some of the limitations of 2D flow and the advantages of 4D flow. So while 2D flow phase contrast MR works very well, it does have some limitations. This is a case of aortic coarctation. The image on the left is a maximum intensity projection image from an MRA showing the coarctation in the proximal descending aorta and the 2D flow plane prescribed. In the middle are the corresponding magnitude and velocity images at that level. And you might be able to appreciate that if that plane isn't placed correctly or placed in an area where there is turbulent flow, the measurements may be inaccurate and a lot of important data might be missed. On the right, we have the same case with 4D flow. These are the path line visualizations showing the complex flow throughout the aorta with areas of helical, vortical flow distal to the coarctation. And because we have flow data in every direction, we can retrospectively place planes at any location and derive a lot more information about flow and velocity at any point along the aorta. In this example, in a patient with aortic stenosis, you can appreciate the elevated velocities throughout the ascending aorta depicted by the red color. And if you can imagine, we did a standard 2D flow on this case and placed the flow plane in the ascending aorta, it might be challenging to capture the true peak velocity of this complex flow jet. And it has been shown in some studies that the techniques, the 2D and 4D flow, agree well when it comes to measuring net flow. The graph on the right shows the good agreement between one-directional 2D flow as well as 4D flow when it comes to measuring net flow. However, there is more variability when it comes to measuring peak velocity, with the standard one-directional 2D flow often underestimating the peak velocity, which is shown in this graph on the left, with the standard one-directional 2D flow measurement of peak velocity underestimated in relation to the 4D flow measurement. Another advantage of 4D flow compared to 2D is it's very easy to check your internal consistency by placing multiple analysis planes retrospectively. This is a nice example showing the internal consistency of 3 measurements placed in the ascending aorta and main pulmonary artery. In patients, especially in patients with complex congenital heart disease, it's important to measure flow at multiple locations so you can accurately quantify flow disturbances or shunts or collaterals. This is another nice example of internal consistency in a patient with tetralogy of Fallot. You can see here that the flow measurements are demonstrating the systemic and pulmonary flow with the relative flows through the right and left pulmonary arteries. For post-processing and visualization, there are multiple techniques used with 4D flow, including vector visualizations, streamlines, path lines, and volume renderings. Here are some examples of maximum intensity projection velocity visualization images, which in some ways is analogous to color Doppler ultrasound imaging. These images can give you a nice overview of what's going on, as well as a good sense of the range of velocities in a data set, because it's fairly easy to appreciate the areas of both high and low flow. Streamline and pathline visualization techniques provide even more detailed flow information. On the left, this is a patient with a VSD, and the streamline visualization nicely shows the complex mixing of blood in the right heart through the VSD. The streamline visualization technique is actually displaying a line that is traced parallel to the velocity vectors at all spatial points along the length through that velocity field. In contrast, the pathline visualization is actually following the path of the virtual blood cells through the velocity field. And in this example on the right, we have a case of atrial septal defect with the pathline visualizations showing the direction of those flow particles. So both of these techniques give you a nice sense of flow directionality, as well as visualizing areas of disrupted or helical flow. Okay, so now we'll get into some of the applications of 4D flow. Congenital heart disease is one of the main applications of 4D flow imaging. It can be used to estimate a variety of things such as shunt volumes, regurgitant flow, collateral flow. And because these cases often have complex anatomy with multiple areas of flow disturbance, multiple flow measurements are required in order to accurately measure these flows. And the 4D sequence, therefore, shortens the overall amount of time needed to scan these patients because all of the measurements can be acquired retrospectively instead of having to prescribe multiple flow planes at the scanner. This is an example of a patient with Fontan circulation with suspected leak at the fenestration on echo. The flow calculations here on the pathline visualization images nicely demonstrate the differences between the flow across the Fontan and the Glen, as well as the visualization of the leak at the level of the fenestration depicted by the purple flow jets. Valvular heart disease is another common application for 4D flow. In cases like this, it helps to be able to visualize where there's areas of stenosis or regurgitant jets. This is an example of a patient with aortic regurgitation, and the path lines here make it easy to see the best location to place the flow plane in order to accurately measure that regurgitant fraction. Aortic disease is another common application for 4D flow. The large amount of volumetric data acquired with these sequences provides the advantage by helping guide where a measurement plane should be made, especially in cases like this as an example of aortic stenosis where there's elevated velocities throughout the ascending aorta. By changing the color threshold of the velocity maps, we can visualize better areas of more severe stenosis. So from left to right, we've increased the color threshold, and on this image you can really appreciate the area where the stenosis is most intense, and the flow plane can be placed orthogonal to that for the most accurate measurement of peak velocity. So, in summary, 4D flow is an effective and accurate tool for volumetric flow visualization and quantification. Flow volume quantification with 4D flow has several advantages when compared to conventional 2D phase contrast imaging. And 4D flow MR is useful for a variety of applications, including congenital heart disease, valvular heart disease, and aortic disease. So thank you for your attention, and thank you again to Dr. Francois for providing so many beautiful images and cases for this presentation today.